Can everybody hear me? Yes. Super. All right. Oh, he had me queued up. Thank you. All right, well, good afternoon, everybody. My name is Jennifer Eskridge, and I'm with the Oregon Poison Center. I'm the community outreach educator, and I'm just going to spend a few minutes today talking with you all about who we are, what we do, and why you need to know about us. Some of you may have heard of us before. Some of you may have seen Mr. Yuck. We still use him as a teaching tool with our kids. Mr. Yuck means no, don't touch, taste, or smell. And if you need some Mr. Yuck stickers, please come by the booth to get them. But just as a refresher, what is a poison? A poison is a substance that, if used improperly, can be harmful. Traditionally, we think about poisons as chemicals, gases, toxic fumes. These can also be organic things like plants, mushrooms, venomous bites. But we also know that substances like medications, cosmetics, personal care items can become poisonous if little kids get into them, if used improperly, taken in the wrong dosage. So how are we poisoned? A poison can be harmful if it's swallowed, ingested, splashed on the skin, spilled on the skin, in the eye, or inhaled. So these are the common ways that we're poisoned. A few examples for you. We have a child that is exposed to something in the home. Maybe they eat a laundry pod. You guys have all seen those. Maybe you've seen them in the news. Or maybe they ingest some chemical in the home, something they found in the garage, something under the sink. Those are all concerns that we have. Another example might be an adolescent who has taken a medication or an illicit drug, and they have some suicide issues. Another example is a medication dosing error by an adult or an elderly person. These are common poisonings that we see all the time at the Poison Center. And something I just want to point out to you, these are all ingestion examples, and we actually get probably 60-65% of our calls are poisoning by ingestion. So the first Poison Center opened in 1953 in Chicago. Now there's 55 poison centers across the country that serve all 50 states and the U.S. territories. Some states actually have more than one poison center because they're so populous, right? And they're serving a lot of people. The Oregon Poison Center was founded in 1978 by an act of the Oregon legislature. And currently we're serving about 5 million people in Alaska, Oregon, and Guam. Places like Alaska and Guam don't have their own poison center, so they contract with us. Okay, so when you call the Poison Center, we are a call center. This is a picture of one of our nurses, Liz. She's been doing this work for 30 years. She's very knowledgeable. And you will get immediate treatment advice and management for the poison emergency. We are open 24/7, 365. We know things happen on holidays, weekends, in the middle of the night. So please know that you can call us anytime that you need us. We also take informational calls. So if you have a question, please don't hesitate to call us. Something that you should also know about the Poison Center is that we have an integral part in the healthcare and public health community. We do a lot of work in terms of disease surveillance, and we might be the first to know about outbreaks because we're getting calls about overdoses or the disease outbreaks. But we also have this special function where we can actually treat a lot of cases in the home. We can prevent you from taking a trip to the hospital. But we always want you to call us first. So please don't hit up Google. Please call us and let us guide you through that. We are the experts. We have nurses, pharmacists, and doctors who are trained in toxicology. They're very smart, and they know what to do. If your patient or loved one is transferred to a healthcare facility, our staff are following that case as long as needed. So they're going to work with the hospital, they're going to follow up, they're going to check back with you and make sure that all the information that they need is given. And I have to say, too, that a lot of times healthcare facilities will call us because they have a very complex toxic exposure in their facility and they need expert advice. So our staff is very knowledgeable. We have interpreters available 24/7 in any language. We also partner with Oregon Relay. So who calls us with questions? Well, a lot of people think the Poison Center is just for families with small children. Please know that the Poison Center is for everybody, and we get calls from everybody, okay? We get calls from 911 dispatchers, we get calls from law enforcement. As I mentioned, we get calls from healthcare facilities. We do get calls from parents. In 2018, we had 56,000 calls to the Poison Center. Some of those were informational, but a lot of them were exposure-based calls. So we really do serve everybody and anybody that has a question or a toxic exposure. I also want you to know that this service is free to you and it's confidential, so there is no charge to you ever, and we really don't want any barriers to you to contact us. But since we are here talking about kids today, I just want you to know a few things about poisoning in kids. About half of our calls involve children under the age of 6, but the most serious cases that we manage are in adolescents and adults, and that actually has a lot to do with the types of exposures that the adolescents and adults are having. So the top 5 calls for kids under the age of 6: cosmetics and personal care products. These are things like lotions, hand sanitizers, makeup, household cleaning products, pretty straightforward. Analgesics, this is like your Tylenol, your ibuprofen, your opioids. Foreign bodies, toys. This is sort of a catch-all, but this could be like loose change, coins around your house. The silica packets, that's a big one for kids under 6. A lot of those get eaten. And then also glow sticks. We get a lot of calls about glow sticks. Those get burst open, and then kids eat those. And then plants, which not all of them are toxic, but some of them can be a concern. So how do we address this? Dr. Hoffman talked some about prevention, and he had a lot of good ideas for you. And I could talk a lot about prevention. I only have a few minutes, but I do want you to know that prevention is really important in terms of keeping your kids safe from accidental exposures, but also from intentional exposures if you have an older child or a family member. We have a couple pictures of lock boxes and a lock bag for medication. We also have a cabinet lock here, and the cabinet locks are really inexpensive methods to keep things locked up in your home that could be mistaken for a beverage or food. You know, I have a look-alike display outside with some household cleaner and a Gatorade. You know, those things, the bottle looks the same, the liquid looks the same. For kids, it may be really hard to tell the difference. The other one is Parmesan cheese and Clorox. That sounds crazy to you, but the can looks exactly the same. And a child who can't read may not know the difference. So we say up and away and out of sight is really ideal, and if you can lock things up, that is the best practice. So we encourage you to lock up your medications. If you have tobacco products in your home, especially e-cigarettes, marijuana, or edibles, please lock those up. Please treat those like medications. They can be very toxic for children. If you need more resources or ideas about how to keep some of these products safe in your home, please come talk to us or go talk with the Dornbecker folks. We have a lot of ideas for you, but the key is just remember up and away and out of sight, and locking them up is the best practice. So the best prevention is actually to be prepared for a poison emergency. As Dr. Hoffman also mentioned, you can be really on top of things, you can be doing everything right, you can be supervising your kids all the time, have great practices in place, and things can still happen. So we want you to be prepared for when things happen. And we want you to know our number and have that handy. National Association for Poison Centers has now established a 1-800 number for all poison centers in the U.S. and the U.S. territories, which means no matter where you are, you call the 1-800 number, it's free, and you'll get connected to the poison center that's nearby. We also now have a virtual card, and I would like everybody right now to put this number in your phone, because in a poison emergency, every second counts, and we want you to have this number handy. So if you would please take out your mobile device, and we can do this together. This works for Apple and Android phones. So if you take out your mobile phone and open up a new message, so like you're going to text message a friend or family member, in the text field, enter the word poison. And in the to field, you're going to type 797979. How are we doing so far? You with me? Great. Send. Hit send. And what's going to return is a text message with a link in it.
Mine's failed.
Did anyone get it? Raise your hand, you got it? Okay.
Oh, my phone was turned off, that's why I failed.
Okay. So click the link in the message. And it's going to open up. It's going to take you to a web page like this. You can click Add to Contacts. And what will come up is the virtual card for the Poison Center. And now you have our number in your phone for a poison emergency. Something happens, you can call us. You don't have to look up the number. You don't have to have the fridge magnet nearby, although we have those for you out there, and we have the phone stickers and Mr. Yuck. But we know sometimes things happen on the go when you're at a relative's house, and we really want you to know how to reach us. Anybody need me to go back?
So how's it going to look in our contacts?
So you should be able to pull up poison control in your contacts. And it'll look like that if you're an Apple user. This was a screenshot from Apple.
And so what's the 800 numbers? 222-1222?
It's 1-800-222-1222. And it should just save right there if you hit the save at the top or wherever it is located in your phone. So I know that was really quick, but I hope you took away a few things and now have our number. If you want to talk more, please get in touch or visit our website, and hopefully we do this again. Maybe I can share some more information with you guys. We have lots of data. We're out in the community doing events, and I hope we can partner in the future too. So thanks again for having me.